Perfect.
And I'm getting an echo.
Oh, maybe I okay. So I'll mute myself on telehealth.
Telehealth. That's good.
Please mute yourself on
That's better?
telehealth.
Yeah, that's better. Okay. And, oh, I'm still getting an echo.
Maybe I'll mute myself on Zoom. No. Right now I'm muted on Anura Telehealth. But
That's
not
1, 2.
Zoom.
I'm still getting it. Okay, do I need to mute myself? Well,
Oh, actually.
oh, but if I do, will it record my voice, right? If I'm on mute, when I do the Zoom record.
Test 1, 2.
Is it because Hamid is still on?
I wonder if are you muted on Anura Telehealth?
I am muted on Anura Telehealth. Yeah.
Okay.
And I'm mute here as well.
You're on.
Testing 1, 2. So even when I go on mute on Zoom,
I can. Oh yeah, that's interesting. I can still hear you through the.
Test 1, 2.
That sounds good.
Test 1, 2. Can you hear me?
Yeah, that's perfect. That's really clear.
Yeah.
Okay, interesting. So I'm not on mute on my end. I just opened it up.
Interesting.
Yeah, I don't know what's going on.
We hide floating controls. Okay. Okay, so Lindsay, thank you for agreeing to be Sarah, thank you for agreeing to be our demo patient today. I'm Dr. Keith Thompson, Chief Medical Officer here at Neurologics, and so we'll just be demonstrating Anura Telehealth. So I'm going to start the system up, and first thing I do is prepare measurement. It's going to give you some prompts, Sarah, just to be able to come in. It should give you some green indicators. There we go. It's telling me patient is ready, and so we will start the measurement. And so what's happening behind the scenes is our novel form of remote photoplasmography that we call transdermal optical imaging. And so we've changed this now to be able to run during a telehealth call. So really quite fascinating. We're using the same technology as the Anura. We're capturing those pulse wave signals within the various regions of interest in the face, the nose, the cheeks. All those regions behave differently. Once we extract that analysis and those pixelated images of blood flow, that goes up to the cloud where the deep effects system is going to do the machine learning analysis. This system has been trained on over 50,000 individuals that we had their ground truth. So that means we had with validated medical instruments, we were able to capture blood pressure, cholesterol levels, hemoglobin A1C and diabetic profiles, all of that information. And then this has allowed us to train these models to recognize a whole host of different parameters. If you include the various versions of heart rate variability, which we're actually seeing on the reading on the lower left-hand side of the screen, there's over 100 different parameters that we can measure. You know, this is really amazing to me as a primary care doc times 30 years. This technology just blows me away. During COVID, one of the problems was, I was locked up at my office. Patients were locked up at home. I could see them by video call, but really what sort of measurements or analysis could I do? So we are for investigational purposes only, but we're seeing some cutting edge technology. As far as we know, there is no one else in the world right now doing this. And I'm seeing a live feed of your vitals as we speak. So imagine, Sarah, if I was in a medical encounter with you, I will let this run for the full 2 minutes and it'll get your vital signs, your systolic over diastolic blood pressure, heart rate variability it's showing as well. It's giving me all those acute indicators of your health status. And when I finish the reading, it's run for about 2 minutes. I will click that we want to end the measurement and I will say yes. And then now, look, this will pull up an extraction of all of the other risk indicators, including cardiovascular risk and metabolic profiles, risk of hypertension, diabetes risk, the physiologic parameters, cardiac workload, that's heart rate times systolic blood pressure, or vascular capacity, which is a measure we're able to see that pulse wave in those regions within the face. We're able to do the analysis of the elasticity of those arteries, which is also an indicator of your cardiovascular health. So really quite fascinating when you think about all that I can do within that 2-minute scan. There's some really other fascinating use cases for telemedicine as well. Remote patient monitoring. We are investigational, but in remote patient monitoring, there are CPT codes within the United States that would allow us to use technology like this because we are in the territory of software as medical device. We could use this during remote patient monitoring sessions without having to be cleared as a medical device, and remote patient therapeutic monitoring as well. Imagine during a psychological interview and being able to get the feedback on heart rate variability, which is that indicator of the balance between sympathetic fight or flight or parasympathetic rest and digest. The higher the heart rate variability, the more fit you are, the more relaxed. The lower the heart rate variability, the more stressed or unfit you are. So again, this really brings some fascinating dynamics into the patient encounter. So Sarah, thank you so much for being our patient today. I don't know if you had any questions or not, but it looks as though you are a very healthy, young, healthy individual, which I would expect.
No, thank you, Dr. Thompson. This is great.
Yeah, wonderful to do this today. Thank you so much, Sarah, for demonstrating this with us.